Hi, my name is Shannon Shearer, and I'm going to be presenting the findings from our scoping review investigating phantom breast syndrome in individuals post-mastectomy. So breast cancer is the most prevalent form of cancer worldwide, and mastectomy, which is the amputation of one or both breasts, is a vital aspect of breast cancer care. However, as treatment for breast cancer becomes more effective, the focus has kind of been shifting from mortality to morbidity. So there's lots of research around pain and other issues after breast cancer treatment. But one issue after breast cancer treatment that is under-recognized is phantom breast syndrome. So much like phantom limb syndrome, when a foot or leg can still be felt after amputation of the leg, phantom breast syndrome occurs when the breast can still be felt after amputation of the breast. So these can be painful sensations, and it's called phantom breast pain when it's painful, and it can also be non-painful sensations, which is called phantom breast sensations. So the literature on this topic is very disjointed. So we undertook this scoping review to synthesize the existing knowledge and also look for gaps in the literature. With respect to the methods, we searched 8 different databases and indexes, as well as 20 relevant websites to look for both peer-reviewed and gray literature on this topic. And ultimately, 1,969 records were found after double screening at 3 stages: the title, abstract, and full text. Of all of these titles, 99 references were included in our study. It was very important to us to keep our inclusion criteria open, especially with respect to population, recognizing that people can get a mastectomy not only for breast cancer treatment, but for a variety of other reasons, including gender confirmation surgery. And even within breast cancer, that it's not only women who can get breast cancer and end up getting mastectomy, but also men and anyone from another gender as well. With respect to concept, we were just looking at phantom pain or sensation going by any name in the study, and the context was open. So the study could be from any date, any region, looking at any cause for the mastectomy. It was very open, but it had to be in the English language. With respect to the results, 99 records were found from the peer-reviewed and gray literature, but none of these records actually came from searches of the relevant websites. So it kind of indicates that although the phantom breast syndrome is being talked about in the peer-reviewed literature, that knowledge may have not had the opportunity to be translated into a medium on the broader web that is more accessible to patients, providers, the general public, people like that. So there was a huge variety in how sensations were described for phantom breast syndrome and phantom breast pain. The most common ones were itching, burning, stabbing, and heaviness of the breast. So feeling that the weight of the breast is still there, that it moves when you move. And there was also huge variety in where these sensations were actually felt. So we thought that there might be a tendency to feel it maybe in the nipple or in the whole breast, but really it varied so much across the studies. 2 studies that investigated location of sensations longitudinally suggested that nipple pain actually diffuses over time. So pain begins as the phantom nipple, but then goes to the whole phantom breast, while sensation may begin in the whole phantom breast and then focus into just the nipple. So this really is a kind of area of this topic that needs to be investigated further. The majority of the studies that looked at distress or severity of sensations did find that it was distressing, however. So clearly this is an issue that is causing people problems in their life. Some studies that also looked at distress mentioned that, maybe it wasn't that distressing because women weren't telling their physicians about it. But this really begs the question, were they not telling the physicians about the sensations because they were not distressing or not bad, or was there another reason? So this aspect of patient education and also looking into how many people do actually discuss this issue with their physician or primary care provider and how many people don't and why don't they is another aspect that needs to be investigated further. With respect to the epidemiology of PBS and PBP, out of 25 studies that reported this type of data, the prevalence of phantom breast syndrome ranged from 8.8% to 66%. So really a huge range. This may have to do with the fact that the studies looked at a wide variety of different populations and also had a wide variety of methods. Many of them were retrospective, so that could have had an impact on the data. But the average was 39.5% with a median of about 37%. So it does indicate that roughly about 1 in 3 people after mastectomy may be feeling phantom sensations. The sensations were also more common than pain on average. So the phantom sensation prevalence was 25.6% versus a phantom pain prevalence of 14.6%. And across papers, many papers looked at the causes of phantom breast syndrome, trying to investigate what determinants might be for it. And across papers, 30 determinants were studied, but really there was no broad consensus on the causes of PBS. However, one interesting trend that we did notice was that many papers that were older, so from the 1950s through 1990s, looked at phantom breast syndrome mainly as a psychological issue. So kind of examining the issue from the perspective of the breast being a core component of a woman's self-identity. But much of the modern literature has shifted away from that viewpoint into looking at it much like phantom limb is looked at, which is as a physiological issue, which may have been caused due to nerve damage or some other issue during the amputation surgery. And that shift in perspective on this issue is also reflected in interventions. So very few studies investigated interventions, but of those that reported on interventions that women were using to manage their pain or sensations, all of the methods that people were using to manage sensations were pharmacological. And of the 3 studies that directly investigated treatments for PBS or PBP, one of them was pharmacological and one of them was surgical. And the third was a form of desensitization psychotherapy called eye movement desensitization and reprocessing therapy. And actually that, as well as paravertebral block, were found to provide some relief. But again, these were just single studies, so more research is needed on that front. And as we can see by this chart on the left-hand side, interventions made up a very small proportion of all of the studies that we found on this topic. The majority of the studies were epidemiological and descriptive. Some of them were reviews, but in terms of practice guidelines and interventions, so kind of mobilizing the knowledge on PBS to be useful to providers and useful to patients, very few of the studies were doing that. So this kind of brings me into what should we do about it? So there is a need for further studies on therapies, both post-surgical, pre-surgical interventions, and peri-surgical, so things that can be done while the mastectomy is being done that might be able to limit or prevent these phantom sensations. But also studies are needed to investigate what people are doing themselves to help these sensations. The research indicates that potentially up to 2/3 of people are experiencing phantom sensations. So an interesting future study could be looking at what they're doing themselves to help mitigate those kinds of painful feelings or distressing feelings. It's also important, I think, to mobilize the knowledge that already exists on phantom breast syndrome and make it more available to the wider public, and also mobilize it to providers so that they can educate their patients that this is a possibility post-mastectomy. And lastly, many of the studies used a questionnaire as their primary method of investigation. So it would be useful as well to promote better data collection about PBS by developing a questionnaire or adding a question to an existing questionnaire like the BreastQ about whether somebody is experiencing phantom sensations in the breast. So the key takeaways from this study are that phantom breast syndrome is common, painful, and disruptive for people post-mastectomy, that the existing medical knowledge about phantom breast syndrome has not been mobilized to patients, providers, or the public, and lastly, that evidence-based therapies are needed to reduce distress and improve quality of life after mastectomy. Thank you very much for watching this presentation. My email will be in the description box below, so if you have any questions, please feel free to email me about them.